Although this medication belongs to the family of drugs classified as antidepressants, it is not only used for the treatment of depression. That's just one of its functions. In today's video here on Doctor for Life, we're going to talk a little bit about fluoxetine. What is it? What is fluoxetine used for? What is its effect? Is there a best time to take fluoxetine? Does fluoxetine cause weight loss or weight gain? Can it cause drowsiness? Stay with me and we'll discuss all of this. I am Carlo Cunha, a family doctor, and this is my health pill for today. Fluoxetine was the first antidepressant of the selective serotonin reuptake inhibitors class. It was approved in the United States back in 1987, so we already have over 30 years of experience with the use of this medication. This class I mentioned includes various drugs you might be familiar with. They're from the same family, the selective serotonin reuptake inhibitors, but they're not the same. Paroxetine, sertraline, citalopram, escitalopram. In another video on this channel we talk about the differences between them. But today, the topic is fluoxetine. Its action is related to serotonin. This substance affects emotions, influences our sleep, our appetite, and especially our mood. It's a neurotransmitter. It's there, acting in communication between neurons. And the higher presence of this neurotransmitter, serotonin, in that transmission region between neurons, the technical name for this location is the synaptic cleft. This leads to better control of mood, emotions, and sleep. And that's what fluoxetine does. It's a selective serotonin reuptake inhibitor. It prevents serotonin from being removed, from being taken up, and that makes this neurotransmitter stay longer in the synaptic cleft, performing its function, which improves the mood of the person who is depressed. Of course, being an antidepressant, the most obvious function of fluoxetine is to be used in the treatment of depression. But don't think that it's only used in depression situations. Other psychiatric disorders and syndromes can also be treated with fluoxetine. Obsessive-compulsive disorder, bulimia nervosa, post-traumatic stress disorder, fibromyalgia. It's used in premenstrual tension situations. You can see that there are several indications for this important drug that acts on the central nervous system. But there are some things that everyone asks me about fluoxetine. Everyone wants to know if fluoxetine helps with weight loss or if it causes weight gain. Does it have any effect on weight? Before I tell you about this important aspect, let me take a very brief pause to ask you that if you're enjoying this video and the content on this channel, please leave a like for me. It really helps by having YouTube share this content with more people. Also, subscribe if you haven't already, and click on the bell icon to enable notifications. So, does it cause weight loss or weight gain? The answer to this question is difficult. It's ambiguous, and the truth is the best answer would be, it depends. No, I don't want to sit on the fence, but that's the reality. Some people may lose weight, and others may gain weight while taking fluoxetine. Let me explain. Look. A person in depression often also experiences a reduction in appetite. They're depressed, not interested in daily things, sad, demotivated. And naturally, they eat less. This person often loses weight when they're in this state. Then they start treatment. A medication is prescribed. In the example we're discussing, this medication could be fluoxetine. The person gradually improves. They regain interest in daily things. They start eating better, and consequently, they gain weight again. However, in other individuals in treatment situations, fluoxetine can lead to a loss of appetite as a side effect, which can result in weight loss for these individuals. But no, fluoxetine is not indicated for treating people with obesity. For such situations there are other treatment options with demonstrated efficacy in studies, and these should be prioritized over fluoxetine. People also ask me about its effect on sleep. Another question with "it depends" answer. Studies have shown that 5 to 17% of people experience drowsiness as a side effect of fluoxetine, and 10 to 33% may experience insomnia. That's why, in general, we prescribe fluoxetine for once daily use and recommend taking it in the morning. But it can also be taken at night. If a person experiences drowsiness after taking the medication, it's better to take it at night. On the other hand, if the effect is interfering with good sleep, causing insomnia, it's better to take it in the morning, to put more time between taking the medication and bedtime. Just two more important things to mention towards the end of this video. Generally, since the goal of fluoxetine treatment is to improve depression when used for that specific purpose, if a person's mood improves, it tends to have a positive effect on their sex life. Improving pleasure, desire. But some people who use fluoxetine for an extended period report reduced desire, reduced erectile capacity in men, ejaculation problems, and even pain during erection. In women, it can manifest as changes in libido and difficulty achieving orgasm. The second thing I wanted to tell you at the end is that fluoxetine does not affect the action of any contraceptives. Like this video, then leave a like, subscribe to the channel, click the bell icon, and most importantly, share it with someone you believe might find it useful. Help me make this information from Doctor for a Lifetime reach an ever-growing number of people. Thank you very much for staying with me until the end. I am Carlo Cunha, a family doctor, and that was my health pill for today.